For more on this, let's bring in Federal Health Minister Mark Holland. Hi, Minister Holland. Good to see you as always. Thank you for making time for the program.
You bet. Thanks, Vassy.
I have a whole bunch of questions that I know our viewers are interested in when it comes to dental care. I just wanted to preface those questions, though, and ask you for a point of clarification, actually, on the issue that's dominated question period. Not the politics of all of it, but drug policy and in particular decriminalization. Because I heard the Prime Minister in the midst of all of it today say on BC's request for an amendment essentially to their exemption, we will, yes, work with them to adjust it in ways they see fit. Is it safe to interpret from that your government will grant those amendments and essentially allow BC to recriminalize public spaces, drug use in public spaces?
Well, I think what's critical here is that we're having conversations with every province and every territory with their health authority, their public health authority, to determine, what the evidence is showing us. And what we're going to do is follow the evidence. These are extremely difficult circumstances, and we have to make sure as people are dying and families are losing loved ones and all of us are crushed by what we're seeing, that we are deliberate and careful in every action that we take. So I think what's fair to say, Vassy, is that we're having very detailed conversations, looking at the evidence, making sure that the decisions that we make are going to save lives and going to protect people, keep our communities safe, and aren't just good sound bites. And that takes a little bit of time. So I'm not ready to proclaim the outcome of that process, but I will say the veracity of that process, the rigorous adherence to evidence is something we will not yield from.
Does that mean that there is the possibility that BC's request could be rejected? Because, and I ask because I understand the consideration of evidence. They are also looking at their own set of evidence and determine that this is what was necessary in order for the program to best work.
Yeah, I just can't engage in a hypothetical. Those conversations are ongoing, and I think it would be prejudicial for me to say how that is going to end, other than to say that, that we greatly respect the work that's being done by provinces and territories in this space. We know that they care as much as we do about saving lives, and that this is a new epidemic that is changing all the time, and we're learning from. And so we have to be adaptable and move with evidence and move. And I know I'm as urgently wanting answers as other people, but I also want to make sure that in our urgency to act, we don't make mistakes.
And I do certainly take your point on evidence, and I've done a lot of other work outside of the show, like studying the issue that you're talking about, because it is a crisis. 14,000 people have died in BC just since 2016. 20 people a day across this country are succumbing to their addictions. I understand the evidence. I also can see and recognize that the public's view of public consumption of drugs, or decriminalization more largely, is shifting alongside what they have seen play out in British Columbia. And I'm wondering, to what degree are you internalizing that in your decision making? Because it's one thing for the evidence to show us that perhaps more lives could be saved, but if the treatment doesn't, the treatment centers don't exist to the degree they should, and the public isn't buying into it as an approach, isn't that not problematic?
Well, the deepest thing I internalize is I've sat across from many mothers and fathers who've lost their children, and you will never forget those interactions. They haunt your soul. Mm-hmm. They are some of the most difficult things to hear. And unfortunately, I'm listening to this all across our country all the time. And my first obligation is to the family members, to helping keep their family alive, and to find solutions that are rooted in evidence. And then the second obligation is to figure out how to communicate that. And it has to be held in that order. And I am worried that there is a temptation sometimes to move to the second order of business before the first. Things that sound good, some of the conservative ideas around using incarceration everywhere as a blunt tool have been tried and have been a disastrous failure. They've led to terrible, terrible outcomes. They sound good and they do enormous harm. And so we have to, in the first order, really defend the process of science and evidence. Sometimes that's slow, sometimes that's cumbersome. I can't imagine how hard it is when people are scared to hear that we are having to be deliberative. But it is the only way forward. And when we look at other health crises that have taken us. I remember, you know, it's not that long ago when you go back to the AIDS crisis, when we were losing people all over the place, and there were people desperate for solutions, and there were people calling for us to do disastrous things that had terrible health consequences. Some of them were done. And looking back, we see the extra harm it did, how much more people were hurt. That's why we have to be careful. And so absolutely it's metabolized. We have to be able to explain to every Canadian how we're keeping communities safe, how we're keeping kids alive, how we're tackling this crisis. But we can't sacrifice evidence, science, or doing the right thing in the process of communicating.
And I do really understand that point, and I think the AIDS example is a really salient one. And my questions to you are, the genesis of them is not what the Conservatives are bringing up. It is, in fact, what people in British Columbia have been conveying to us. And I understand, I've sat across from those moms too, right? And it is incredibly, incredibly awful what they are going through. There is no doubt about that. But is it not also your responsibility to worry about moms and dads who are concerned about what their kids are seeing in a playground or their own feeling of safety in a playground? Is it not also your worry for nurses whose own union said that this is a really big problem, that there was open drug use in hospitals? Like, is that not a concern for your government too?
I wouldn't be a human being if the answer wasn't yes. Absolutely it is. You know, this is something that grips me every day in this role. I can't tell you how hard it is to have to look at the damage that this is doing each and every day. And so we're moving at the absolute fastest pace science and evidence will allow us to tackle this. And I can tell anybody who's listening that my heart and soul ache from this every inch as much as yours does. That this is something that we have to come together, set aside differences. There are great places to cross partisan swords. This isn't one of them. We have to be relentlessly focused on solutions, working with every level of government, strongly rooted in science and evidence, moving to assure people that we're doing everything we can, because that is exactly what this crisis demands of us.
I'll move and I'll make a hard turn, if you don't mind. My apologies for that going on as long as it did, but I think it is really important to Canadians. And the other issue that's important to them as well is dental care and the launch of the program today. The latest numbers from your government show that about 16% or just over 16% of oral health care providers have so far signed up for the program. What does full participation look like for you, and when do you anticipate that happens?
Sure. Well, I'm really excited to say that we're over 7,000 dentists who are participating now. So that we've been seeing really strong pickup over the last week, and particularly the last couple of days. The conversations that we've been having with dentists I've been methodically working through their issues. You know, I had a conversation with the head of the Canadian Dental Association last night. And a new head of that association, which is an ongoing part of conversations I've had since day one in this job. Every time they have an issue, we fix them. I really think we've worked through them all. And now it is time to deliver this. And I'm very encouraged by the numbers. For example, today, Vassy, at 3 p.m., 3,500, actually more than 3,500 Canadians had received services through this plan in its first day. That's a remarkable number. So we're making sure we get that progress. We got the new portal that's coming July 8th, but I'm encouraging dentists to use the existing means. If you don't like the existing portal, just use it till July 8th, then drop out. You can use the new one on a case-by-case basis. But, you know, this is wonderful. I was here in London talking at the University of London at the Schulich School of Dentistry to more than 100 dental students who are all itching and raring to go to serve Canadians and recognize that that means that everybody deserves oral health care, and that's where we're getting to.
I just want to unpack a couple of things you said there. You said 7,000 dentists. I just want clarity, because your colleagues, your cabinet colleagues today in their announcement around this said 6,500 oral health care providers have signed up so far, which is obviously inclusive of more than just dentists. Is it 7,000 dentists alone?
Yeah, so the numbers have changed even since it was last reported. So that 7,000, it includes almost exclusively dentists. There are other hygienists and others that are in there. So I should be careful on that, but it's almost in its totality dentists. There may be a small percentage of others. We're bringing other hygienists and whatnot in, but really in the earliest days, the largest number of participants haven't been from the dentists.
And then I just want to ask you, because you mentioned you spoke last night to the head of the Canadian Dental Association. I spoke with him today on my radio program, and his sense was, he's certainly not saying it's never going to work, but his sense was that there were still an inordinate amount of questions among dentists about how it will work, and therefore the uptake was very much impacted. Again, I'll put the same question to you. What does full participation look like, and when do you anticipate it?
Well, I don't know what the issues are. I mean, if I can be really straight with you, I mean, we've worked through them all. The only one that I'm really aware of now is their position that the patient would pay. And upfront. And I'm not going to have a senior earning, $25,000 a year in a position where they've got to upfront the cost of their dental. That doesn't make sense. That's not fair. The dentists, we told them we're going to pay them in less than 2 days when they submit a claim. And that's for this process right now. For pre-authorization, which comes in November, we're going to work through to make that as fast as possible, even for the 10% that isn't an automatic 2-day payment. So, asking that to put on patients, that's a red line for me. That won't change. Look, it's time. Every time the dental associations have told me they have an issue, we fix it. And then there's a new issue, and we fix it. And there's a new issue, and we fix it. At some point, we got to move forward. This is a fair plan.
But don't they have to be signed on for you to move forward and for this program to be a success?
Well, they are, and I think that's the great news. As I say, 7,000 so far, and that number is growing rapidly every day. And it's because when dentists interface with this, they see that this is just like any other insurance plan. I just put the number into the computer, I click submit, and then 2 days later I get paid. End of process. It's very, very simple.
And you anticipate 90% of them will get paid in that 2-day frame? Because what happens if they're not, and then they have incurred the cost? Because, as you said, I think it's understandable. You don't want Canadians making that kind of money having to pay up front. But that means that the dentists have to bear the burden of those costs, right?
Well, that's why we're paying them in 2 days. And that's a service standard that we've established from the onset. Well, not from the onset. I mean, that was part of the negotiations. We've been making that tighter and tighter, working with them. We've been able to get that down to 2 days. I think that's fair. I think that's fair to say you're going to get payment in 2 days. And it means that on the other side, that we took what was a 27-page document. I agreed with them. That was way too much information in there. We got it down to a 2-page a standard claims and processing agreement. And then I even said, okay, that's still too much for the dental associations. I said, we'll create a new portal that doesn't even require that you can just go on a claim-by-claim basis without...
Yeah, I mean, you made that concession after they explained to you how cumbersome what you had initially outlined was.
Well, I mean, look, it is a 2-page standard claims, standard claims and processing agreement that exists for every other insurance plan unreasonable?
I mean, when they already have a full patient load, perhaps?
Well, no, because it's the same thing for every other insurance plan. Then they'd have to reject every insurance plan they have. Every insurance plan has baked into it terms and conditions, right? So, and I've said, fine, I accepted that. I accepted that they didn't want to use that. They wanted to have an alternate portal. I created that. But then even after creating that, you're having some associations say that it's still not enough. And I respect they have a job to do. They're negotiating, and they're trying to see how much that can be got. But there are patients here. They need service, and we have a plan that is based on the existing structure of the insurance plans that exist out there, and we want to work with them. And I know that their same objective is to get patients that care. But the time now is to act. This is essential. We have seniors who need dentures. We have seniors who need preventative care so they don't wind up in hospitals. We need folks to be able to have those healthy, happy smiles. We're getting there. We see a huge day today with wonderful progress. We've been able to do that together through working collaboratively. The negotiating process is always a difficult one, but now we really have to get on to the business of delivering this program. And I want to continue working with dentists as we have to fix any and all issues that will come up along the way. But I think when they interface with this, they'll see that it's as easy as any other plan that they've worked with out there.
I'm going to leave it on that note. Minister, I appreciate your time as always. Thank you so much.
Thanks, Vassy.